What is the difference between spontaneous labor, induction of labor, and augmentation of labor? I'm Dr. Shannon Clark. I am a double board certified ObGyn and Maternal-Fetal Medicine specialist, and I'm going to tell you. Spontaneous labor is when patients come in regularly contracting and changing their cervix without any medications or any form of induction. Nothing used to bring on the contractions, if you will. That's spontaneous labor. Now, spontaneous labor can occur in the preterm period. It can also occur in the term period. So spontaneous labor can occur at any time. The other thing about spontaneous labor is that it doesn't always lead to a spontaneous vaginal delivery. Sometimes labor stalls out. If we're talking about patients that are in labor at term, spontaneous labor can stall out, and there may need some help by augmenting labor with Pitocin. So augmentation of labor means you either are in spontaneous labor and it stalls out, not contracting like you should, the cervix is not changing anymore, and you need some help with Pitocin to get things going again so you can go on and progress through labor and delivery. Augmentation of labor is also a part of the induction of labor process. Let's talk about that. Now, an induction of labor means methods and medications are used to start the process of labor, and that could be for medical reasons or medically indicated, or it can be elective induction of labor, like at 39 weeks plus. The first thing to consider when undergoing an induction of labor is what the cervical exam is. When assessing the cervix, we look at all of these things up here: dilation, position of the cervix, effacement, station, and cervical consistency to come up with a Bishop score. If the Bishop score is 6 or less, then the patient will need to undergo something called cervical ripening. That's the first part of the induction of labor process. Now, effective methods of cervical ripening include two forms: mechanical cervical dilators and the administration of prostaglandins, namely PGE1 and PGE2. The most common PGE1 is misoprostol or Cytotec, and the most common PGE2 is dinoprostone in the form of Cervidil or Prevadil. Now, here are the most common mechanical dilation methods. This is circled right here. The ones that are most commonly used would be either the single balloon Foley bulb or the Cook catheter, which has the two balloons that goes on either side of the cervix. Now, once the cervix starts to dilate and become more favorable, then we can start the augmentation of labor process with Pitocin. Now, there are some patients who come in for an induction of labor, whether it's medically indicated or not, with an already favorable cervix, and that's typically patients who have given birth before. If they come in and their cervix is already favorable, then you don't have to use those cervical ripening agents. You can go ahead and start the induction process by going straight to Pitocin. If that happens, then Pitocin is used for both induction and augmentation. Now, there are some people who get induced with cervical ripening agents, like I discussed before, and they go on to labor on their own and never require Pitocin. That can happen. I hope this has cleared some things up.